When people decide to take that approach, how can they maybe change their overall health? A lot of people want, you know, hey, I got XYZ is bugging me. What can I get real quick to fix it and then move on with my life? You know, can we eliminate that part, or at least reduce a lot of the medications that people are on if we take a different approach and try to, like you said, center yourself a little bit more?
I think the one study or group of studies that really looked at that is chronic pain and mindfulness meditation. The bone cancer studies, you know, and if you have bone cancer, you know, bones don't get perfused with blood very easily. They don't get a lot of that. So if you give medication, it doesn't often get to the bone as easily. So there were studies with people with bone cancer, and what they were taught was to meditate on the pain, which is completely opposite. It's not take something for it. It's like, here's the pain, it's there, it's there. And what we're taught to do is be present to it, to feel it, but not what some of my friends call layer it. So it's like, how many times do we get a pain? I get it, you know, I hurt my toe or something, and what do? Oh, so I'm holding my breath. We know that's going to have an impact. I'm tightening all my muscles, but it's like, I layer and go, oh, when is this going to go away? I want this to go away. I don't like this. And I don't like it causes me to tighten up. Versus saying, I don't like this. Yeah. I'm going to breathe with it. I'm going to feel it. I don't have to respond to it. That's so hard for a culture that says, get over it. Move on. Oh, I mean, we're a culture now that with death, you know, in 2 months, if you're still grieving after 2 months, it can be considered pathological that you're still sad. Your spouse, your child, your parent dies, and on day 61 or 62, you're still grieving. Now it's pathological, and we can give you medication for it. We can help you get over that. In other cultures, it can take 2 years. So we're a culture that constantly says, dissociate. Look at your Facebook page, post something. I'm bored, nobody's talking to me. I better hurry up and do something. And what we're saying in this whole approach is a different way to live. So in those bone cancer studies, when patients were able to do that, their pain went down. In some studies, the pain went down on the pain intensity scale. In other studies, the pain intensity didn't go down, but the ability to cope with it and be with it, in other words, to tolerate it, increased. And that's an amazing thing. And then if you can tolerate it more, you don't need as much medications. So I point to that. That's an extreme example. But if people with bone cancer can do it, I hate to say that, then can't we do it with other things? And that's the approach. How can we slow down? If I do that, I won't layer. I won't constrict against whatever I'm feeling, which causes more problems.